Welcome to the first edition, if you will, of the Focus podcast. The goal of this podcast is really to dig very, very deeply into the biggest challenges that are facing our country, to address the questions of faith and culture and public policy that have a profound impact on you and your family. My name is Russ Latino. For 10 years, I worked as a lawyer, practice that was focused in constitutional and business litigation in Mississippi. And after a 10-year career, I decided to make a big leap from the practice of law into the world of public policy. Now, you may be thinking, hearing that, oh, great, another guy that went from being a lawyer to a politician. That's not, in fact, the path that I took. Instead, I started a chapter of a public policy organization, a nonprofit called Americans for Prosperity in Mississippi. Americans for Prosperity is a great organization, some phenomenal people, permanent state infrastructures in 35 states with staff on the ground. And in Mississippi, super proud of what we built. We built a good staff, a phenomenal group of grassroots activists who are really dedicated to advancing the ball in Mississippi. Ultimately, worked great with a lot of good leaders in the state, got to know a lot of people in the media, a lot of people in other organizations, and really to focus deeply on the kinds of public policy that we thought would ultimately create opportunity in Mississippi. The idea really at the outset was pretty simple. We didn't want this to be a Republican thing or a Democrat thing, a conservative thing or a liberal thing, or putting one demographic above another demographic. Really, the way that we were looking at it is, can we advance the kind of public policies that ultimately create opportunity for all Mississippians? And the reason that I made that jump was super important to me. I had spent most of my life in Mississippi, was very aware of the way that people in other parts of the world and other parts of the country viewed Mississippi, viewed most of that as being really unfair. But if you look at it statistically, Mississippi is last in all of the things you'd want to be first in, and first in all of the things that you'd want to be last in. And so around the time that I jumped from my law career into the world of public policy, um, my wife and I had started a family, had both a son and a daughter in pretty quick succession. And looking at my kids as a dad, I was just really compelled by the idea that I wanted them to grow up in a place where they could be proud to be Mississippians. It's a wonderful state with phenomenal people, great opportunity and potential, but that they could be proud to live their lives there, to have a job there, to be a part of a vibrant community, to raise a family of their own, and not to be the butt of late night talk show host jokes. And so that was sort of what compelled me to engage. And in that time, saw a lot of success, was part of a coalition that passed the largest tax reform package in Mississippi history, passed first in the nation comprehensive occupational licensing reform that ultimately rolls back regulations, allows more people an opportunity to go out and seize their American dream, to start a business, to become an entrepreneur, to take care of their family. And then was super proud of working across the political spectrum on things like criminal justice reform that in some ways preceded or predated a lot of the national effort that we saw with things like the First Step Act that's occurred in the last couple of years. And so about 2 years ago, I got requested or got a call to see if I would be interested in moving the family from Mississippi to DC to work nationally on economic and healthcare issues. And made the decision to do that. Actually, don't live in DC, live in rural Northern Virginia, good ways out of DC, because I guess why you can take the boy out of Mississippi, you can't take the Mississippi out of the boy. Didn't want to be in the city. But for the last 2 years, have managed economic and healthcare initiatives at an organization called Stand Together, also a very good organization with a lot of really good, dedicated people who want to help other people find success. And so, as part of that, worked on a full range of policies at both the state and the federal level, from spending and taxes to debt to regulatory reform, labor and employment policy, healthcare policy, that really was at the forefront of the national debate even before the coronavirus. And over the course of this podcast, we're going to talk about all of those things, but we're going to start with the thing that is completely subsuming the national conversation right now, that has dramatically impacted health outlooks, economic outlooks, the way that government is engaging. And that is obviously the coronavirus. It's the reason that I'm doing this podcast. For a number of years, I've had friends and family say, hey, you should do a podcast or blog or whatever. And really kind of was reticent to do that. But I've had a lot of time to sit around and think over the last month or so and decided to bite the bullet and try. Talk to some young folks who said, hey, if you're going to do this, you got to blog it. Didn't even know what that was. Clearly have a face for radio. But here I am. And so let's get started. I'm going to talk very quickly. I'm going to cover a lot of information, but hopefully you find it informative. And if you do, I hope that you'll share this material in other places as we start to build out the podcast with welcome feedback as well. So if we're going to talk about the coronavirus, it is super, super important that we not just focus in on one aspect of it. Right now, there's people who are just treating the coronavirus as a healthcare problem. And there are people who are treating the coronavirus just as an economic problem. And there are people who are looking and truly just focusing on what is government going to do in all of this. And the reality is that it is a healthcare and economic and a government problem, right? It's not just one. And if you only focus on one, you're being short-sighted. It's a holistic range of problems that require holistic vision and a holistic set of solutions if we're going to emerge from this strong. So we're going to talk about all three of those components: healthcare, economy, and government today. And let's get started with the healthcare component of it because it's the one that probably has been driving the ship, so to speak. So let's just start very basically with a question. What is the coronavirus? Well, the coronavirus is actually a family of viruses. It's not just one virus, right? These are viruses that exist in animals that cause respiratory tract infections. Scientists have known about coronavirus strains for decades and decades. We know now that there are 7 strains of coronaviruses that have crossed species barriers into humans. 4 of them you're pretty well acquainted with, right? 4 of them are what we associate with the common cold. So if you've ever had the seasonal common cold, you've come into contact with a strain of coronavirus, typically fairly mild. In the last 20 years, there have been 3 novel strains of coronavirus. I want to talk to you about what it means when we call something a novel strain. All it really means is before we identified it, we didn't know it existed, right? It's new to us. So if you hear somebody say novel coronavirus, that's what they mean. It just means we hadn't previously identified it. So there have been 3 of those. One in 2002 and 2003, SARS, severe acute respiratory syndrome. You'll remember hearing a lot about SARS. You've probably heard a lot about it in the context of the current coronavirus strain. So SARS, happens in 2002, 2003. In 2012, there is another novel strain of the coronavirus where we have an outbreak called MERS. It's Middle East Respiratory Syndrome. And then obviously the most recent novel coronavirus strain is the one that is causing COVID-19. So it is what we're talking about today. So if you look at the 3 novel strains, SARS, MERS, and the coronavirus that causes COVID-19, um, if you're a scientist looking at those 3 things, you're going to evaluate viruses like these coronaviruses really with a series of factors, but 2 key elements are transmissibility or how transmissible the virus is, how easily it spreads. There's actually a way of measuring that, something called an R-naught score, which is essentially looking at it and saying, if there's an infected person, how many other people are they likely to spread the infection to? That's what is meant when you hear something like an R-naught score, right? And so transmissibility is part of it. The other part of it is if you get infected, how severe is that infection likely to be? Is it likely to cause real complications? Is it likely to cause death? And so if you want to evaluate these 3 novel strains, you would look at SARS and say, we have about 8,000 confirmed cases of SARS between 2002 and 2003. And there's a case fatality rate of about 800 people or about 10%. So Case fatality rate is literally just how many confirmed cases do we have, and we use that as the denominator to divide into how many people actually died that we attribute with that disease and that virus. If you look at MERS, even less transmissible than SARS, about 2,500 known cases of MERS, about 900 deaths. So the case fatality rate with MERS is about 34%, incredibly high. So both with SARS and MERS, what you see is relatively low transmissible nature there. It's not spreading easily, but if you get it, it's a fairly high case fatality rate with both of those viruses and the disease that's caused by those viruses. Comparatively, if you look at the current coronavirus that causes COVID-19, um, you see dramatically higher numbers when it comes to how transmissible it is. As of today, about 1.8 million confirmed cases with the current strain of coronavirus. And let me stop and say what a confirmed case is. So early on, if you looked at numbers coming out of China, there was great fluctuation. And that's because China was continually changing the way that they counted confirmed cases. They had clinical diagnosis, they had lab diagnosis, and they were kind of fluctuating from week to week in some cases, how they were counting those cases. But when you're looking at confirmed cases, you're really talking about laboratory confirmed cases with what is a swab test of the nose or the mouth to determine whether or not the virus strain is in the upper respiratory tract. So 1.8 million confirmed cases versus in SARS 8,000 or in MERS 2,500, way more transmissible, but way less deadly as a percentage, right? So 115,000 deaths, that's a heck of a lot more than 800 or 900. But the percentage of people who become infected and ultimately succumb to COVID-19 and pass away is far lower. The case fatality rate on a global scale right now with the coronavirus that causes COVID-19 is about 6%. In America, that case fatality rate in the United States is about 3.9%. So even lower than the global experience. But it's super, super important to recognize that the case fatality rate only tells a part of the picture. That if you listen to scientists who are worth their salt right now, they're saying that a mortality rate with this strain of coronavirus is likely at or well under 1% of the infected. So how is there that discrepancy between a 6% case fatality rate and what people think the actual mortality rate is? And it has to do with the fact that these scientists aren't relying simply on confirmed cases. They're relying on their understanding of how transmissible this virus is based on some early studies and some developing studies that tell us that while there may be 1.8 million confirmed cases, there are probably millions and millions and millions of people who have or have had the coronavirus that were never tested because their symptoms were mild or they were asymptomatic or because testing wasn't available at the time. You'll probably recall that there's been a lot of controversy and conversation around the availability of testing, and it's dramatically ramped up. But early on, a lot of the testing wasn't available. There were a lot of defects in the test, and so when scientists say we think the mortality rate is actually at 1% or even lower, that's based on this understanding that there are tons of people that haven't been confirmed as cases but have in fact come into contact with and been affected by the coronavirus that causes COVID-19. And you may ask, well, how does it affect people and how do we know that? Well, we know that because early studies show that even amongst confirmed cases, even amongst people that did feel sick enough to go and get tested. About 81% of those people were really mild in terms of the symptoms that they presented with. So there were symptoms like low-grade fevers, like cough, like congestion, like fatigue, that in many ways mirrored or were comparable to what you would expect with the seasonal flu. These are people amongst confirmed cases that weren't being hospitalized, certainly that weren't having severe problems, things that led to things like needing to be on a ventilator, for instance. Far smaller percentage of the population, even amongst confirmed cases that needed to be hospitalized, and an even smaller subset that had severe symptoms that led to things like getting on a ventilator and ultimately having fatalities. So we know that from studies. We also know from some pretty unique circumstances, thing like the Diamond Princess cruise ship that was quarantined, where you had this massive number of people that tested positive for coronavirus, but a big chunk of those people reported as being asymptomatic. So that's all important context as we think about how we address the health concerns. So then the question becomes, well, how exactly do people catch the coronavirus that leads to COVID-19? And you keep hearing me say that. Let me stop and explain why I keep saying coronavirus that leads to COVID-19. The words have been used interchangeably in a lot of instances, but the coronavirus is the virus that causes the disease COVID-19, which is just shorthand for coronavirus disease 2019, which is when we first identified this virus, or when we first saw people present with this virus. So one analog to it, and I'm not comparing this in any way to HIV and AIDS, but one analog to help understand sort of the difference in terminology is that HIV is the virus that causes AIDS. Well, this novel strain of coronavirus causes the disease COVID-19. So how is it spread? Well, it's spread through droplets. As I'm talking right now, there are droplets coming out of my mouth. When I cough or I sneeze, droplets come out of my nose and my mouth. If you're in close proximity to me and I have the coronavirus and I sneeze or cough, and you ingest that into your body, then the infection can take root in your upper respiratory tract. And the way that works is that coronaviruses have these protein spikes on the outside of the virus. You've seen the pictures. There's a reason they call it corona. It means crown. Those are the protein spikes that you see in the pictures. And they attach to something called an ACE2 protein receptor in your cells. Attach to that, invade your cells, and start to replicate. And so then the question becomes, well, how severe is it if that infection occurs? And the answer is it really, really depends on how your immune system reacts. You can have a strong immune system that effectively fights it off and develops antibodies. You can have an immune system that puts it in a hyperdrive and causes a different kind of complication because it's too strong. But typically speaking, if the infection is contained to your upper respiratory tract, your nose, your throat, your mouth, then you're talking about relatively mild symptoms, the kind of symptoms that we talked about earlier, coughing, fever, fatigue, that sort of thing. Where it gets complicated is if the virus makes its way into your lower respiratory tract. And that's when you can start to see things like bronchitis and pneumonia developing. It's when, in severe cases, you see something called ARDS develop, which is essentially the lining in your lungs thickens, actually as a defense mechanism, but it prevents air from the air sacs in your lungs from getting into the bloodstream. You need oxygen in your bloodstream to survive, to keep your organs alive. And ultimately, that's when you see cases that end in that sort of acute stage where there are ventilators. So that's sort of the progression of the virus, what happens when you catch it. And it also explains why it's so very important to use sort of the advice that's been given about how to deal with this. So we know that if there are two forms of transmission, we know that if it is transmitted through droplets, either through direct ingestion because you're in proximity to me and I cough or sneeze, or what scientists believe is that droplets can settle on surfaces, and then if you touch the surface and then touch a mucous membrane, your eyes, nose, or mouth, that you can transfer it that way. That sort of informs the way that we respond to this, right? So on the second, way that it's transmitted through surfaces to mucous membranes or touching in the face, that's why you hear people stressing the importance of good hygiene. That's why you hear people say you really need to be vigilant about washing your hands and about not touching your face. And in the first form, where you're projecting it because of sneezing or coughing, that's why social distancing is in place. And look, these aren't new concepts. They may be new in the way that they're being described in some ways. But if you look back at another global pandemic, the Spanish flu in 1918, The Spanish flu happens when soldiers from World War One come back to the United States and essentially spread a virus that they had picked up when they were in Europe fighting. Ultimately, there are three waves of the Spanish flu. The second wave ends up being very bad. You end up seeing about 50 million people globally die because of the Spanish flu, 675,000 in the United States. But what we see emerge in Spanish flu are different areas of the United States reacted very differently to the onset of that virus. So, as an example, if you look at Philadelphia and St. Louis, a great contrast. Philadelphia, soldiers come back, virus starts to take off. They hold a ticker tape parade. And within 72 hours, their medical community is completely inundated, right? Hospitals are operating above capacity. Medical personnel are getting sick. There's a dramatic spike in the number of deaths associated with the Spanish flu. Contrast that with St. Louis and how they dealt with it. Well, in St. Louis, they said, hey, look, we're going to ask schools to shut down and we're going to ask people not to gather in large settings. And effectively, what they were suggesting is that you engage in a form of social distancing as a way to prevent the spread of the virus. So some of this is not new in the way that we're thinking about it. Um, Similarly, if you look at the concept of flattening of the curve, um, not entirely new. Now, there's been a lot of misnomer about what it means to flatten the curve. A lot of people think that the reason that we're all staying at home, the reason that we're staying away from each other, is because we can eradicate this novel coronavirus strain, and that's what it means to flatten the curve. In reality, what it means is that what we're doing right now was designed to delay or or sort of spread how the virus itself spreads. So it was designed that way to prevent one of those big spikes like what you saw in Philadelphia back in the Spanish flu of 1918 that overwhelmed hospital capacity and medical staff. Really, it was designed as a way to allow us to catch up when it comes to our ability to treat people with severe instances of COVID-19 resulting from this coronavirus. So taking all of that into account, I think it's pretty important to understand who this has the biggest impact in. We talked about how it's spreading. We talked about the reason that we take on things like good hygiene and social distancing and what we're trying to accomplish by flattening the curve. But it's important to have a picture of who is most vulnerable to this idea of it getting in the lower respiratory tract, to the idea that the immune system doesn't fight back sufficiently to prevent this from becoming severe. There is no doubt that this virus is transmissible to anyone, that it does not discriminate on the basis of age or race or sex or anything of that nature, right? Like that everybody is potentially a victim of being infected by this coronavirus. What is dramatically different is who has the most severe reaction to an infection. So while it is true that Tom Hanks had the coronavirus, and while it is true that there are politicians and athletes and YouTube influencers and silly young people who went and did spring break and contracted the coronavirus, what is almost certainly also true is that those people are not the ones who will ultimately die as a result of the contraction of the virus. It is anecdotal at best if you hear a case of a young person who passes away as a result of this. Normally, it's because there's some other comorbidity or immune compromise problem, because it's just not happening. It's the exception by a lot and not the rule. Where we're seeing hospitalizations, where we're seeing fatalities, are overwhelmingly people who are 65 years or older. Overwhelmingly, the numbers bear that out. The other thing that we're seeing is that overwhelmingly there are comorbidities involved. And all that really means is that there was already heightened health risk before the coronavirus was ever contracted. The New York, where it was kind of the epicenter of the United States outbreak, so many of the initial cases, so many of the deaths. The New York Department of Health has come out and said that 86% of the deaths that they have identified as being caused by or having COVID-19 as a contributing factor have serious comorbidities, hypertension, heart disease, cancer, emphysema, COPD, diabetes, all these things that already raise the risk profile for people. And so we have a pretty good sense now that it affects older people. So you should be concerned about your parents and your grandparents and people with comorbidities that already had real health risk. So taking that all into account, one of the things that has consistently come up as we try and use health information to make decisions about other things that are happening is, can we trust the modeling? And I want to go into some detail about the origin of this disease to really kind of be able to explain why the modeling has been problematic in a lot of ways. So, people say, well, it's been so wrong. There really have been two models that United States health officials have primarily relied on. The first model was one coming out of the Imperial College of London by an epidemiologist named Neil Ferguson. Ferguson said that as many as 2.2 million Americans would die as a result of COVID-19, apart from additional government intervention. Essentially, it was, unless you change something about the way that you're currently operating, we're going to see 2.2 million deaths. If you look at the information coming out of the University of Washington, which is the model that people really are relying on right now, the University of Washington model always showed a smaller number than the Imperial College London model. But even it has experienced significant downgrades in projections around fatality, from hundreds of thousands of people to the latest number or projection being about 60,000 people in the United States that would ultimately pass away as a result of COVID-19. And look, I don't want to make light of the fact that 60,000 people may die as a result of this disease. That is significant. That is a sizable net increase, right, in the grand total of the number of people that will pass away in the United States. But given some context, there are 6.6 million people in the average year in the United States that die. There are 660,000 people that die from heart disease. There are 600,000 people that die from cancer, pneumonia, and the flu. If you look at total numbers with lower respiratory tract infections and seasonal flu, those numbers are also very high, in fact, higher than the current projections around what COVID-19 will do. So it's not that it's insignificant. It is really good news that the numbers have changed so dramatically. And even with the University of Washington model, they've acknowledged that we've peaked, that we're on the downslope. The low range that they've suggested is a range of, I think, 24,000. Now, there have already been 22,000 deaths that have been attributed to COVID-19 in the United States. So that would be sort of an ideal scenario coming out of this on sort of the downslope of this initial wave. But why have the numbers been so different? Why have they changed so much? And so there are a lot of people like Dr. Fauci and others, Neil Ferguson, who would say, well, the numbers changed because you guys did the right thing, right? You started to implement social distancing. You started to change practices. It shortened or reduced the transmissibility of the disease by separating people. And because of that, you're not going to have the worst case scenario. And there's certainly some of that is true, right? We have taken some good steps that probably have prevented the spread of this disease, and there'll be a ton more data over time that help us parse that out. But part of it also was that the data was not great initially, right? So this was a brand new strain of virus. We didn't know exactly how it would operate. We didn't know if it would be similar to SARS or MERS or operate very differently. It clearly has operated differently than those two outbreaks. And so the initial data was really bad, and models are dependent on the quality of the data that they receive. And in this vein, it's important to acknowledge the role that China and the World Health Organization have played in potentially causing bad models on the front end. And this is not meant to be some sort of sweeping indictment or hyperbolic xenophobia or anything like that. It's just factual, right? So what we know is that the evidence suggests that there were patients presenting as early as mid-November with symptoms that we now associate with COVID-19 in China. Now, whether or not people knew that that was some sort of new viral strain, it's impossible to know that really. The symptoms at the mild stage look a lot like the flu, which we've talked about. Whether or not they should have anticipated that it was something new, hard to know. We do know that by mid-December, enough of these cases had started to pile up that doctors were talking about something new. That doctors were looking at a phenomenon that was leading to increased instances of pneumonia in big groups, and thought there's something odd about this. And there was a young doctor in his mid 30s who started to identify and thought that he had identified that this was essentially another outbreak of SARS. It looked like SARS to him. And so he got online in some group chats with other medical professionals and started to say, hey, look, I think we're experiencing another outbreak of SARS that had petered out in 2003. Um, the night that he did that in that group chat, he was called in by the police in Wuhan to sign a statement saying that he was spreading false rumors and that he would stop spreading false rumors, that he was presently in violation of the law for talking about the potential that this was another SARS outbreak. The great irony of that, and maybe it's not really irony, it's indicative of what Chinese officials actually believe versus what they made this doctor sign, is within 2 days of this, um, the Chinese officials had shut down the seafood market in Wuhan where this is believed to have originated. So it's believed that this virus originated from bats. It's not clear whether or not it crossed into an intermediate host and then ultimately ended up in humans. Very similar, by the way, with SARS and MERS. SARS went from bats to civet cats to humans because Chinese were consuming civet cats. And in the Middle East, MERS went from bats to camels to humans. So similar progression in the way that this crossed species. But within a couple of days of shutting down this doctor from talking publicly about what he thought he was identifying, they shut down this market. On January 5th, Chinese scientists sequenced this virus and figure out that it's 86% similar to SARS, but it is in fact a novel strain, a new strain of a coronavirus. A couple days later, the first official death. There's some indication that there were deaths that were occurring before then that likely are also attributable to COVID-19. Um, but on January 9th, the World Health Organization comes out and says, hey, look, nothing to be concerned about. We've got this viral strain that's new, but there's no evidence that it is transmissible from human to human. They essentially repeated the propaganda that the Chinese had already put out, even though there was ample evidence and conversation about medical staff contracting this. There was an escalation of the number of people who were presenting with these symptoms. There was essentially a denial of what people knew, and the World Health Organization parroted that denial. The following week, some scientists from Hong Kong get invited into China, and they get invited in to do some investigation into Wuhan about what's going on. They go to hospitals to investigate, and they bring with them some reporters from Hong Kong. And on the way out from their investigation, the police stop the reporters and tell them, you're not allowed to talk about what you've seen. You need to delete any photos or video footage that shows the inside of the hospital. And so there really was this concerted effort going on as this virus ramped up to constrain the amount of information that was coming out about the virus in the initial weeks. Um, January 18th in Wuhan, by the way, Wuhan's a huge city. It's not some podunk village. There are 11 million people that live in Wuhan, um, bigger than New York, right? So on January 18th, they have this huge celebration in Wuhan, and there are 40,000 families that gather for a banquet as this virus is really taking hold. And mind you, Wuhan is a transportation hub. You got trains coming in and out. It's an international flight hub. Millions of people in the period between when this doctor first acknowledges or recognizes that something is fishy, and ultimately when they shut things down, travel in and out of Wuhan, across China. It's a big period of travel because of the Chinese New Year, which is when hundreds of millions of people in China travel. And you got people also traveling internationally, obviously, with business and whatnot. So all of this is going on in the period of time between when patients first sort of present with symptoms and when finally they get serious about the problem. And they get serious about the problem on January 20th. when a renowned scientist in China comes out and says, no, 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 this in fact is transmissible between humans, from human to human contact. And 3 days later, the Chinese government absolutely locks down Wuhan, stops all the travel, stops the ferries, the buses, the trains, etc., flights. There are advantages to being an authoritarian regime that oppresses people, that you don't really mind things like civil liberties, for instance. So they shut all of that down on January 23rd. That same day, the World Health Organization comes out, again praises China, again says, look, it may be transmissible from human to human, but there's no evidence that it's been transmitted from human to human outside of China, and we think they're taking the appropriate steps. Well, all these people that have been traveling are spreading this thing around. So you start to see cases of infection in Thailand, in Japan, in South Korea, in Iran, in Italy. All these outbreaks start to occur all over the world, ultimately leading to, more than 180 countries having infection problems. The United States obviously was not immune from that as well. First infection was a result of someone who had been in China and traveled to the United States. And then we started to see human-to-human transmission from people who had not been in China. But all of this is unfolding, and the World Health Organization comes out and says, really not that big of a deal yet, right? And there's this internal debate, and there's evidence of an internal debate at the World Health Organization about whether or not to even call this a health emergency. They don't do that until January 30th. Um, and then you see, even after that, lots of sort of tepid warning about what this could become. In fact, there was internal debate about whether or not to call it a global pandemic, even though there was considerable evidence that it had spread to multiple continents fairly early on, and that infection was occurring from human to human. It's really kind of the definition of what a global pandemic is. They didn't do that until March. And so a lot of what you hear the WHO saying, even though they were giving warning, it was relatively tepid. And, it was being repeated by scientists in the United States. It was being repeated by journalists in the United States. There are examples of both right-leaning outfits and left-leaning outfits like the Huffington Post that reported in February and on that actually the bigger threat to the United States right now was the threat around the seasonal flu. That was not something that was uniquely positioned on one side of the ideological spectrum. People were largely just parroting what they were hearing from the World Health Organization, which was largely parroting what was coming out of China, and the data out of China was not good. So you saw people like Dr. Fauci and like Larry Kudlow and others in the administration who were really pretty insistent. Hey, you got to let us in. You got to let our own scientists in so we can really dig into the data and understand what's happening in China. And that, frankly, just did not happen. They did not want people from outside of, contacts in the World Health Organization, from places like the United States, having access to the data. And so Neil Ferguson and the University of Washington, they were using this very early data, and their models improved as they got access to data from other places, as they got a clearer picture of how confirmed cases were being counted, what mortality rates look like in other places, or case fatality rates look like in other places. This is also why testing is so important. And look, early on, the CDC absolutely bungled testing. They didn't want to take tests from other places that had some defects and concerns. They wanted to develop their own test. They wanted to administer their own test. They really weren't positioned in a way where they were giving health agencies and states the right knowledge to be able to administer tests. And so they developed this test kit working with manufacturers. They did it quickly, to their credit, that essentially had three different tests within the kit. The first two, if they came back positive, were positive for this strain of coronavirus. The third would be positive for this strain of coronavirus, but also positive for SARS. So that if you had a test with the third indicator and not the first two, we would know that it wasn't the coronavirus that causes COVID-19, but that it was SARS. The problem was that the third part of the test was defective. And so you had all these agencies trying to apply these tests, and it wasn't working. And it took weeks for the CDC to come back and say, you know what? Since we haven't had a SARS outbreak since 2003, just forget about testing the third part. Test the first and second part, and figure out if the person's got the coronavirus that causes COVID-19. A relatively simple fix, but it took a decent amount of time to get there. And these tests are the swab tests that tell you whether or not you have a current infection of this coronavirus. Um, and to the US's credit and the administration's credit, they have dramatically ramped up testing that's available to people who think that they have the coronavirus right now. The second test that is probably equally, if not more important to truly understanding the scope of this problem is what's called a serology test. And some have been developed and they're being tested themselves. The idea behind the serology test is when the human body is infected with coronavirus, it generates these antibodies. These antibodies fight off the coronavirus. You may have had the coronavirus and been asymptomatic or had mild symptoms and weren't tested because it wasn't available or you didn't think you were bad off enough to get tested. But the serology test is designed not to tell you if you currently have it, but if you have had it. And why that is so super important to these models is it helps us understand how many people have had it, what the antibodies look like, how likely people are to have recurrences and that sort of thing. And then ultimately, how fatal is this actually? Because if it's the seasonal flu, if mortality is actually 0.1% and not 1% and not 4%, if it's that low, then if we have a second wave or we continue to have problems with this strain of coronavirus, we can respond in a more targeted way. We can look at it and say, you know what, instead of doing a nationwide shutdown, we're gonna focus on people who are most vulnerable and make sure that they're protected and that we mitigate against those risks, recognizing that this is going to run its course. It's either going to become something like a seasonal flu long term, or we're going to be in a position to know that it's not as deadly as we thought it was before. So that's why the testing is so important to the models and our understanding of how to respond to the health crisis. Because in the absence of better information and better data, we've been flying blind, and we've been making decisions based on what the worst case scenario would be. Now we have a sense of how transmissible it is. We have a sense of mortality rates, and we know who it affects in a severe way, and that can help to craft better, more targeted responses moving forward. So here's the next question about this, and the question is, well, what happens? What do we do coming out of this? Is it over? Well, there are three possibilities about how this coronavirus could ultimately play out, even as we're on sort of the downslope of the first wave. If you look at the Spanish flu, I mentioned there were three waves earlier. There was an initial wave, a much more significant wave, second wave, and then a smaller third wave. So you have the potential, and there's some scientists who have prognosticated that you could end up seeing multiple peaks or waves of this coronavirus. You have the potential that it could do what SARS did. SARS petered out, and we really haven't seen any new outbreaks or instances of it. So there's a chance that this could just peter out. And then the third thing that could happen is that it could become another example of a seasonal common cold, right? That it becomes something that recurs annually. You look at the common cold right now, it's really not transmissible during summer months. It's not because it's not transmissible at all. A change in conditions, there's more humidity that weighs down droplets, just less people getting affected. It gets cold again, you see greater infections for a multitude of reasons, but some of it has to do with weather. So you've seen some people talk about that early on. There's a chance that this could become like that. Now, that doesn't mean that it will be as severe if it becomes like a seasonal common cold. In reality, we're going to have built antibodies to this thing. And over time, there will develop herd immunity to this thing. And so, if you look at this against, like the seasonal flu, for instance, the sequencing of this virus suggests that it's not going to mutate a lot versus what you see in the seasonal flu. So with this, there's less chance that we get all these new strains over and over again where we have to develop new antibodies. In effect, if it happens as a seasonal common cold, it won't be as severe as what we've experienced in this first wave. This first wave has been severe because our bodies weren't accustomed to it. They weren't ready to fight it. This also raises a question about things like vaccines and treatments. It's funny that people hate pharma so much until something like this happens, and then suddenly it's like, well, why isn't pharma developing vaccines faster and treatments faster? Some of that has to do with the fact that they have to jump through incredible bureaucratic hoops to be able to bring these things to market, and we are trying to relax some of those things to the administration's credit during this crisis, and there are bigger questions about whether or not we should relax them on a longer term basis or a permanent basis. But the reality is, it's not as simple as clicking your fingers and saying, here's a vaccine. Not only does it take a while to test these things for safety and efficacy, but even if you accelerate it, there's no guarantee that scientists are just going to come up with the right vaccine. They didn't for SARS, they didn't for MERS. Um, Treatments are slow developing. And this is one of the reasons why, if you've got super safe drugs that are already on the market, like the Gilead drug or like hydroxychloroquine, um, that we know from decades of using these drugs or years of using these drugs that they're safe, that it's worth a shot to figure out. Essentially, you're running clinical trials, um, efficacy trials um, across the board, right? So all of that is sort of where we are in our understanding of the virus itself. So now I want to switch gears and talk about, based on the virus, what we've done with our economy. Voluntarily, what we've done, businesses that, were responsible, who said, hey, look, we're going to let employees work from home. We're going to let employees telecommute and work remotely, all of those things. And then what we've done on a government basis, whether it's recommendations strongly against getting out of your house, recommendations against doing non-essential business, whatever that means, recommendations against travel, or mandatory actions that have been taken by governors and by the administration and by global governments across the board that have actively prevented engagement in the economy. And that's been done because people didn't know how severe this would get, and because they wanted to protect public health, which is noble and the right way to think about things. But you also have to factor in the economic consequences. And so I want to start by mentioning and describing the economic consequences that this is truly unprecedented. We've had global pandemics before. We've never had an instance where, on a global scale, we hit the pause button on our economy. Even with the Spanish flu in 1918, I mentioned St. Louis had implemented some social distancing measures. A lot of that happened on sort of a region by region or city by city basis, and none of it was as extreme and at the scale that we see now, with literally all these businesses shutting down operation or dramatically reducing capacity. So this is brand new. We have put our economy into sleep mode in a way that has never been done before in all of human history. And so there are real questions about what that means for the economy. And there are some initial indicators that it's really bad. And so I want to talk to you a little bit about what we know now and what is likely to occur based on what we know now. We didn't know a ton about the virus, but much easier to track economic impact than the data sets or new data sets around the virus itself. So I want to start global, and then we'll move to the United States. If we start global, what we know, there's an organization called the International Labor Organization at the United Nations. The International Labor Organization tells us that there are 3.3 billion workers in the world. It's a lot of people, right? And 81% of those 3.3 billion workers live in countries that have implemented some form of a shutdown. So that's a huge number of people that have been impacted by government response trying to stem the tide of the spread of the coronavirus. 81% in countries that have recommended shutdown, 50% in countries that have mandated shutdowns. So 50% of that 3.3 billion, not a math whiz, but I think that's 1.65 billion workers, live in countries that have mandated shutdowns. And what does that mean? Well, what they're projecting is that in the second quarter, the second fiscal quarter of this year, which is April, May, June, that in the second quarter, there will be a reduction of work hours of 6.7% globally. That may not sound like a ton, but the equivalent of that is 195 million lost jobs. The International Monetary Fund at the beginning of this year said that there were going to be 160 countries that had per capita income increases, where you saw citizens in those countries making more money. What we know now is that the IMF is now saying, just 4 months later, is now saying that 170 nations will have per capita income decreases. So we're going to have this dramatic reduction in the number of people working. We're going to have a reduction in the number of people who are earning more money. In fact, most people are going to see less money as a result of the economic consequences of crisis arising out of the coronavirus. And then it's not spread out equally. So Oxfam, which is an organization really of organizations dedicated to the eradication of poverty, says that 500 million people are going to be pushed into poverty globally because of COVID-19, and it's going to affect individual industries pretty differently. So the industries primarily affected are manufacturing, retail, public-facing stores, and things of that nature. And so this is a huge percentage, something like 38% of all workers that fit into that category, that work in that category. Obviously, there are other industries that are also affected. The airline industry comes to mind as one that has been dramatically affected. If you look at the number of flights in mid-February, commercial flights are about 111,000 commercial flights per day in February. If you look at flights as of last week, there were about 30,000 commercial flights per day. But that doesn't even tell the whole picture or story, because if you're talking about 25% of the number of flights, but there are far fewer people than normal on those flights as well. And we have some data from the TSA that says that last week, last Monday, the TSA screened 108,000 travelers in the United States. If you look at a year ago on that same date, April 6th, the TSA screened something like 2.8 million travelers. So you're talking about a number of people that are traveling in that industry that has not been so low since the days immediately after the September 11th terror attacks, if that gives any context to how that industry is being impacted. And the truth is, whether you're talking about manufacturing or retail or something more niche like the airline industry, in a lot of cases, these are employees that work paycheck to paycheck. These are not typically, a big number of professional employees that can work remotely, that have some cushion. These are people that already struggle to make ends meet in a lot of cases. And so the industries that are most impacted also have the employees that are most vulnerable, and that creates a real problem. I want to focus now on what that means in the United States. So in the United States, we're seeing early indicators of how significant this could be. And in other forums, I've talked about the fact that, hey, this could be Great Depression levels of unemployment. Now, when I say that, I don't mean that we're going to have another Great Depression. I do not think that is going to happen. That was a multi-year contraction of our economy where unemployment numbers stayed sky high at 25% for a super long time. What I'm talking about is during this pause, the short-term unemployment numbers could look like the unemployment numbers from the Great Depression. And I'm not unique in saying this. Goldman Sachs and their economists and mathematicians have looked at it, and they have steadily increased the employment or unemployment numbers that they expect as a result of this to 15%. JP Morgan has done the same thing. They're projecting unemployment up to 20% and then leveling out and getting better towards the end of the year, but still being significantly bad towards the end of the year in terms of what they're projecting. So the unemployment numbers are going to be high. Well, what does that mean for our economy on the whole? Well, it means that if people are working less or not working at all, that the economy is going to shrink in a pretty dramatic way. The way that economists do this is by estimating gross domestic product and looking at what is the total value of the goods and services that are going to be produced and sold, plus the additional money that's being put in the economy through government spending. Uh, and that's a pretty loose approximation, but that gives you some idea of the way that they look at this. We're looking at a 10% contraction of our economy in the second quarter of the year. Annualized, it can be a little misleading, But if you look at like the Goldman Sachs number, they're projecting 34% on an annualized basis in the second quarter. All that really means is if these conditions stayed the way that they presently are for the rest of the year, how bad would it get? That doesn't mean that they think that they're going to stay that way for the rest of the year. JP Morgan, even worse, at 40% annualized contraction for the second quarter. So we're talking about some really big numbers and the economy shrinking. Well, what does that look like on Wall Street and Main Street? Well, in Wall Street, we've seen dramatic hemorrhaging, right? We closed the year on December 31st when the first official case was recognized by the Chinese government. We closed the year showing about 28,000 on the Dow Jones Industrial Average. It kept going up through mid-February, peaked on February 12th, close to 30,000. And then after that, what we started to see as it became apparent that it was going to affect the rest of the global economy, we started to see it falter and drop. And really in March is when we saw the biggest drops. So between the peak of February 12th and about mid-March, we saw a 37% drop in the value of the Dow Jones. Now, that doesn't just affect big businesses or big investors. That's your 401k, that's your retirement. It's a pretty good harbinger or indicator of the economy writ large. It generally actually precedes or predates a lot of what ultimately gets felt on Main Street and in your communities, right? So this huge drop. Now, if you look at the whole period from December 31st to today, it's about a 17% drop. So we've had a recent bounce really on two sets of news. The passage of the CARES Act, which is a $2.3 trillion injection of resources into the economy, not counting the sort of the Federal Reserve monetary policy tools that were being implemented. It's like $4 trillion of additional tools sort of at their disposal there. So there was a big jump on that news. And then the second wave where we've seen a jump is when, groups like the University of Washington have acknowledged that we've peaked, that the number of infections are starting to go down, the number of deaths are starting to go down, projections are not nearly as bad as we thought they would be. And so there's a higher likelihood that the economy starts rolling again. In the short term, markets hate uncertainty, economies hate uncertainty, and there's been a dramatic amount of uncertainty about how long this would last and what that means for business shutdowns. So all of that seems to indicate some positive news around what's happening on Wall Street. But on Main Street, the problems are just really starting. They're really coming into shape now. So if you're talking about small businesses, if you're talking about the mom and pops in your community, those are businesses that are more likely, that are more susceptible to economic harm as a result of what's going on right now. Why is that? Because small businesses generally operate with substantially smaller margins, right? They have thinner margins on average than some of the larger business profit margins. And they typically don't have the same kind of cash reserves or liquidity that you would see in larger businesses. And so they're less likely to be able to weather a storm than, say, a Walmart or Target or a business like that. They're also more likely to have been deemed non-essential. Lots of the businesses like the Walmarts and the Targets are still open because they're selling basic goods. But lots of small businesses have been deemed non-essential. And because of that, what you see is not only are they not positioned to survive a downturn or a reduction in capacity, but they're being even more impacted by the fact that they're more likely to be a business that's shuttered by virtue of that label. And I don't want to say I understand why people are trying to draw these distinctions. I understand the point is to increase the likelihood of social distancing and slow the spread of the virus, flatten the curve. But I have a real problem with describing any business as non-essential, and I'll explain why I have that problem. And if you're hearing that noise right now, the air conditioner just came on. It's super loud. Sorry about that. Maybe eventually I'll figure out how to deal with that. But, the problem with describing a business as being non-essential is this. If you're a small business owner, the chances are you've been working 80, 90, 100-hour weeks, pouring yourself in to that business. You've sacrificed time with your family. You've put your life savings into that business. For you, that investment is not non-essential. And if you work for one of those businesses, if that's how you pay the rent or your mortgage or how you put food on the table, then that is not non-essential to you. And then looking at it as something that can be compartmentalized is naive. Believing that there is a set of people with sufficient knowledge about the way that the economy works, that they can understand all the unintended consequences of these sorts of interventions is naive. The butterfly effect in an economy as complex as ours is immense. Up and down the stream of commerce, small businesses are buying and selling to other people who in turn have their own employees and their own obligations. I'll use an example. So if you're a small business and you pay rent to a commercial landlord, that commercial landlord in turn has to pay a commercial mortgage. They have to pay premiums, insurance premiums. They have to pay property taxes. All of that has a tremendous impact up the stream of commerce. You have lending institutions then that have these commercial mortgages, and they have strain on their ability to do business and help other small businesses. And so this is not a small problem. This is, the livelihoods of tens of millions of people across the country that we're talking about when we talk about small businesses. And we know early on that the numbers bear out a dramatic impact on those businesses. Over 250,000 stores are shuttered right now. Analysts say about 15% of those stores will probably never reopen. Howard Schultz, the former CEO at Starbucks, says that these small independent retailers and restaurants, that he thinks as much as 30% of those businesses will never reopen. Now, some of those businesses were struggling before this and were going to close anyway, but some of them were not, and they will never reopen because of this. Wall Street Journal reported that there was a 97% decrease in foot traffic for non-grocery retailers in the second half of March. 97%. Well, how does that compare with the big boys? How does it compare with businesses that have been allowed to stay open? The reality is that the big are going to get bigger because of this. They're going to have the ability to buy up other businesses. They're going to have the cash reserves to weather the storm. And in many cases, they have already been sort of deemed essential, so they've got a leg up to start. Walmart data suggests a 20% growth year over year in the last 2 weeks of March. So that's a boon for them. Same thing for Target, 20%. Amazon is at 35% in that same time period, based on some initial analysts' sort of understanding of what's going on in those businesses. And so dramatically better for those businesses. The other thing that this is going to do from an economic standpoint is it really is going to increase the trajectory that we were already on, right? Some of what happens with these kinds of crises is that they accelerate existing trends. And so, over the last several years, we've seen an increase towards online retailers and online business. It counts for somewhere between 10 to 15% of all retail business if you look at the various analysts on this issue. So what's happening now? Well, a group called Ameris and Good Data have done some research on credit card transactions for online sales, looking at the number of those transactions. And what they see is for online only retailers, a 52% increase in March in terms of the business that they're doing year over year, and a 56% increase for folks that operate primarily a store-based model but also have online sales. So dramatic increases towards online shopping that candidly, those habits that are developing right now for people are unlikely to go away. People are not just going to go back to what they did before. There are plenty of historical examples of this where crises accelerate trend lines. Another example of this will be around like movie theaters, for instance. They were already really struggling. Fewer people with streaming services were going to see movies. That's going to dramatically increase as companies figure out ways to bring sort of blockbuster films directly to on demand. You'll see that industry change in real ways, and maybe be a shell of its former self in real ways because of this. So there's going to be impacts, across the board, but it's going to be manifest differently in certain parts of our economy. Small businesses really struggling, and certain industries are going to see trend lines really change. But one of the things that hasn't been talked about is what does this mean for governments from a revenue standpoint? And so if you look at it and you've got substantially fewer people working, or they're working reduced hours, that means less income taxes being paid into the system at both the federal and the state level. It means less payroll taxes that pay for things like Medicare and Social Security being paid into the system. Well, Medicare Part A was already due to become insolvent in 2026. Social Security was already due to become insolvent in 2034. It's going to be super interesting to see the revenue impact of this whole thing and how it affects some of the projections around those programs that seniors rely on, things like Medicare Part A and Social Security. But it's not just income tax and payroll tax. If you've got fewer people working and businesses selling less products and services, that means that corporate income taxes at both the state and federal level are going to go down. If you've got businesses selling less products and services, it means that sales tax revenues in states are going to dramatically decrease, which is a real problem because most states primarily rely on sales tax revenue to fund government. And then if you look at the instances of people not being able to pay property taxes at the local level, that's going to affect local tax revenue. And it's important. I didn't mention the potential of another housing crisis, but I'll segue or go on a tangent for a second and mention the potential of another housing crisis, similar to what we saw in 2008 and 2010, where you could very well see a scenario um, where there's tremendous growth in the number of people who can't pay either residential or commercial mortgages. We already see some numbers that suggest that that could happen. Some of that is being incentivized by some of the relief that was put into the CARES Act. But the Mortgage Bankers Association said that in the first 2 weeks of March, there were almost 1,300% more requests for forbearances on residential mortgages. In the last 2 weeks of March, an almost 1,900% increase for forbearances on residential mortgages. Now, there are some protections that are in the CARES Act against foreclosures for a period of time on federally backed mortgages, which doesn't include all mortgages. Um, but if this persists, what you're likely to see is more defaults. What you're likely to see is more strain on financial services. And you could see a scenario unfolding that looks very similar to the financial crisis of 2008 to 2010. I mentioned that one of the other things that we see is for multifamily family properties that also typically the owners of apartment complexes also have mortgages. But what you see unfolding there is a scenario where people aren't paying their rent. So the numbers from April show that by April 5th, only 69% of people had paid their rent, compared to a period last year or April of last year, the number was 82% paid their rent on time. So dramatic decrease there on people who paid their rent on time. So if people aren't paying their mortgages, chances are they're also not paying their property taxes, and that's going to have an effect on local revenue. At the same time, the demand for government services has gone up dramatically. We have these huge packages passing out of Congress that we'll talk about in a bit, but you also see states with more demand now for unemployment insurance benefits, this massive wave of people that states are responsible for some of that, right? Federal government has tried to stem the tide a little bit with injections of resources to state governments, but that's going to be a big burden. You look at the number of people who are moving from being employed to not employed and recognize that means that Medicaid rolls are going to go up unless we get the economy moving very quickly and people get moved back into the job market. So if Medicaid rolls go up, that's already the second largest spending item for most states behind education. It's already busting budgets. We're talking about an increase on that burden. That's one of the reasons that you saw in the second congressional package an FMAP increase or federal matching increase to Medicaid of 6.2% to try and address some of that, but that's going to be a big burden on states. So there are lots of things like that that are actually going to increase the cost of government at the same time that revenue's gone down. Now, if you're the federal government, you just take out debt, right? You add to the 23 trillion in debt that we've got right now, another 2.3 trillion, and then another 200 billion on top of that in another deal. And by the way, those numbers are astronomical, right? It's way more than what the entire budget is that Congress passes every year, discretionary budget that Congress passes every year. So numbers going way up around debt, but the federal government just takes on more debt. And eventually your kids will end up paying for it. Your grandkids will end up paying for it. Eventually, we'll see interest rates go up in the same way that credit card interest rates go up. If your lender doesn't think that you're going to be reliable, they're worried you're not going to be able to pay them back. In order to lend you money, they start asking for more back in return. And so, that becomes a problem with debt service and all sorts of things that crowd out other forms of government spending, that crowd out the private sector economy. Spend hours on that. But at the state level, there's not that opportunity. Now, some people will say, well, at the state level, there are balanced budget amendment constraints. Most states don't actually have true balanced budget amendments. They have essentially debt limits, caps that are in their constitution that don't allow them to accrue debt over a certain percentage of their gross domestic product or existing spending. There are different measures for that. But states are not in a position to just be able to take on debt the way the federal government is in a position to take on debt. And the end result of that is you're going to have just horrible situations with state budgets. That's one of the reasons that the CARES Act, the third phase, had, I think, 175 billion for state and local governments to try and address some of that. But I'll tell you, that will be wholly insufficient if the economy does not get rolling again. That will not be enough to address the problem. Now, I'm not suggesting that we should spend more. I'm suggesting that we should get our economy moving again as quickly as reasonably possible, understanding the health implications of it, right? So all of that is pressure on states. So the question then becomes, what does a recovery look like? And early on, there were people saying, well, we'll have a V-shaped recovery, right? Our economy was humming before, and that's absolutely true. Jobs were being created. People were making more money. There was consumer confidence. All of that is true. But some people say, well, we'll bounce right back because things were going well before. I think that's naive. I think that's a fairy tale at this point. Maybe if it had been a very brief pause, we might have had a V-shaped recovery. Most economists today that are kind of worth their salt would say that we're either going to have a U-shaped recovery or we're going to have a Nike swoosh recovery. I think that's more likely, a precipitous decline, and then slowly digging our way out of it. I don't think we're headed for some period of prolonged recession or prolonged depression, but I think it's going to take more time than a V-shaped recovery to get us there. So it's worth talking about how we come out of it, the things that government is doing, the things that government can do, and some of the risks or threats associated with government action right now. And so it's super important at the outset of this to understand the differences and why it's so unprecedented from other financial crises, right? So I just, to the extent I haven't made this clear, I'll reiterate the importance of looking at, people who are comparing this to 2008 or people who are comparing this to the Great Depression. There's information that is relevant, but there's a lot of stuff that is distinguished. So, the Great Depression is caused primarily by man-made decisions. It's caused by people who decide to implement bad tax policy, bad Federal Reserve policy, and bad trade policy in proximity to a decline in the stock market that actually bounced back, by the way, before the prolonged depression period, on both sides of it, right? That ultimately extended the duration of the Great Depression and created a lot of pain. 2008, 2010, it's man-made. It's a confluence of bad business practice and bad government practice that incentivize really risky lending in the mortgage industry. Those mortgages get packaged together and sold and moved around. And as long as the housing market was continuing to appreciate, things were fine because even if somebody defaulted, you could turn around and sell it and still be on the plus side. When when that housing market began to fluctuate, when there began to be some volatility because nothing appreciates in perpetuity, then you have the financial crisis, right? This is so different in that there is no man-made element of the economic uh, part of this. I mean, there certainly have been decisions made by governments, but the reason for it is much closer to an act of God. It's much, much closer to an act of God. It's also different in sort of the starting point. So if you look at, as an example, the Great Depression, or if you looked at the 2008, 2010 financial crisis, you would see this kind of slowdown in consumer confidence. Um, None of that was at play. As I mentioned, our economy was roaring. Um, and so this is why that's important. Because it largely is an act of God, if you look at the cause, um, there's not the moral hazard problem. When you have man-made created economic crisis, there becomes a moral hazard problem where governments are essentially rewarding industries, bailing out industries that made really bad decisions, as an example with the 2008 crisis. And essentially, they're rewarding people for their misdeeds, which means that people are more likely to commit those misdeeds again. In a situation where there isn't moral hazard, you don't have that problem. So if you look at sort of the cause of it, it suggests that this should be treated differently. And then if you look at just not even just the scope of it, but if you look at it compared to some of the things that other people have mentioned as possible analogs or comparison points, people have talked about natural disasters like Hurricane Katrina. People have talked about acts of terror like 9/11. And certainly those things had profound impacts on both regional economies and the economy writ large. But there you're talking about essentially what is property damage in a localized area that can be easily assessed, where you can sort of design a plan for recovery pretty easily. And you're not talking about something that's systematic, that's global economy scale cause like what you have here. And so truly unprecedented moment, both in terms of or with the confluence of the cause and then the scope compared to other instances. You know, there hasn't been certainty about how long this is going to last. There hadn't been certainty about the scope of the problem, and it's been done on a scale that has never been seen before. You know, the instances with the Spanish flu again. There certainly were social distancing that was put into place, but it wasn't this kind of thing. And so, if you're conservative or you're libertarian and you're looking at this and you're saying, well, should we really engage in this? Um, what's government's proper role? And you're using as a comparison the Great Depression or the financial crisis. I think those are probably not great comparisons as to what government's role is. This is much closer to effectively what would be a regulatory taking. Government identified a threat and they took action to prevent the threat of the health crisis, and that action resulted in economic hardship and economic loss. And what we see now is not Keynesian style stimulus, right? Because the economy was roaring before. What we see now is effectively a stopgap for people who have been asked to stop engaging in the economy. It is recompense or relief versus this sort of notion that I think is a fallacy of the ability to create um, economic or aggregate demand in the economy. So all of that makes us different. But the longer this persists, the more likely that we're going to have consumer confidence, job maker confidence, all of that affected in a way that you could see this thing getting prolonged. So that's why government stepped in the way that it did. And it really did it in three sort of tranches at the federal level. It did an initial tranche of about 8.3 billion to prepare health organizations and health agencies to be able to respond when it comes to supplies and testing and all of that stuff. It did a second tranche that was really focused around paid family leave and paid sick leave. The idea there was really if people are about to get sick, if this infection is about to spread, and businesses aren't shutting down, then we want businesses to offer to their employees the ability for them to take time off of work, to not be present among other coworkers while sick and spread it. So we're going to have paid sick leave and paid family leave. And on the back end of that, we will offer to reimburse employers with tax credits for what it costs them to do the paid sick leave and paid family leave. The problem with this idea, and an indicator of why government is not great when it comes to intervening in the economy, is that effectively small businesses that were already operating on thin margins looked at it and said, hey, look, if X percentage of our employees end up taking paid sick leave or paid family leave as a result of this bill, then we're not going to be in business by the time we can take these credits. We'll never be able to claim them. And so you saw an initial wave of layoffs that occurred as a result of the effort to actually help people, which is not abnormal when government doesn't understand sort of the unintended consequences of some of their efforts. Now, luckily, in the third phase, they tried to address some of that with some fixes. The other thing that the second sort of tranche, if you will, did was that it expanded access to telemedicine for Medicare recipients, which is a phenomenal thing. It's a great thing that came out of that package. And then the FMAP, the increase in the federal matching for Medicaid, the 6.2% increase that I mentioned earlier, was also a part of the second tranche. In total, the CBO has estimated at about $200 billion package. The third tranche is the big boy. It's the 2.3 trillion that people have talked about. So with that third tranche, a lot of people have talked about the direct payment. I would actually make the argument that the direct payment made a ton of sense. But with the understanding that any government relief in a situation like this needs to be super timely, government needs to get out in front of it as much as they possibly can. It needs to be very targeted so that the people who are most harmed are the ones that stand to benefit, that there's not a lot of corporate welfare, that there's not a lot of graft, that this isn't an opportunity to attach a bunch of pet projects or controversial political agendas, but to actually provide relief, to be targeted. And then it needs to be temporary, right? This does not need to be a permanent expansion of programs, a permanent expansion of the size and scope of government. That's not the point of government engaging in emergency relief. And so with that understanding, direct payments made some sense. You have people who are filing for unemployment, who are losing their jobs, who have reduced hours and reduced wages. And there's going to take some time before the economy starts moving again and they return to full capacity with their work. And it's going to take some time if they need to get into a social welfare program for them to enroll. So a direct payment helps to stem the tide, right? It helps to make sure that people can continue to make payments on really essential things, that they continue to provide for their family, that there's not chaos and acts of desperation that unfold. But the importance of that is that it be timely. I think that they could have designed it slightly better. I don't have a problem with the idea. I think it could have been designed slightly better to be both more timely and more targeted. What they did is they said we want to be targeted. So the way that we're going to be targeted is we're going to look at 2008 tax returns, and only people that made under a certain amount are going to get the full benefit of this direct payment. The problem with that is if you had a flight attendant making 80 grand in 2018, that flight attendant could be destitute today. It's a really bad indicator of someone's current financial condition. The other problem is it took a really long time. We're just finally seeing checks hit mailboxes and bank accounts, and they passed the bill weeks ago. They could have done it more timely and more targeted by sending checks out to everybody, and then on the back end adjusting, looking at 2020 incomes when people file their 2020 income taxes in 2021 and making adjustments. Doing it that way would have actually ended up costing the government less, particularly for people who end up doing well for the rest of the year, even though they might be struggling now. And it would allow you to be more targeted based on people's actual economic condition. It's neither here nor there. It's not how they did it. They could have possibly done it better. The other component pieces, a lot of conservatives or libertarians have said, well, only 250 billion of this 2.3 trillion dollar package made its way to individuals. And they're basing that on the cost of the direct payment. It's a really unfair way to look at this. So the two largest component pieces beyond the direct payment and looking at, for instance, the 175 billion that went to state and local governments, the two largest pieces are two loan programs. One that really is designed for larger businesses, and one that's not designed for small businesses through the SBA that are government-backed loans. And so those loan programs really are designed similarly as a stopgap, as a bridge loan, essentially to keep people in business. But they're designed far better than similar programs were during the financial crisis because they're designed for payroll protection. There are conditions on the receipt of these loans involving payroll protection, making sure that you keep people employed if you receive these loans. And so it's a misnomer or inaccurate to say that only that direct payment portion is ultimately designed to help workers. The reality is that the vast sum of all of these loan programs that hopefully will be paid back at some level really were designed for payroll protection. It wasn't like in 2008 where in 2009 where you saw shareholder buybacks and executive compensation packages. They learned that lesson and actually designed these in a pretty smart way. Now, listen, the package is huge. There are things in there that shouldn't be in there. There are industries that got sweetheart deals they shouldn't have gotten, but they have, armies of lobbyists and the right connections, that sort of thing. That happened. But on average, they hit the right marks and it was designed pretty smartly. Because if you don't do that with these loans, what you end up with are loads of people firing their employees, and then you add to the unemployment rolls, it makes it that much harder to get the economy started. So that part was smart. Were there stupid things in the package? Yeah. $25 million for the Kennedy Center in Washington, D.C. Look, the rich and the posh don't need a place to go and watch the ballet that is government funded or government supported during this crisis. They just don't. There are bigger fish to fry, right? But that's relatively small potatoes when you're talking about this whole thing. Now, what I'll point out, though, is that we would be in far better shape to deal with this, to respond, if we hadn't been so fiscally reckless before now. If we weren't operating with a $23 trillion debt or $56 trillion in unfunded Social Security and Medicare liabilities, or massive amounts of state and local pension unfunded liabilities across the board, right? If all of that wasn't happening, if we were being responsible, then we would be much better positioned to deal with these kinds of crises. As it stands right now, what we're talking about doing is essentially passing on tax increases to our kids and grandkids. We're talking about a scenario in which our debt costs a whole lot more money, and it means that we can't provide as many of the core government function services that people have come to expect. It means that the government spending subsumes a larger percentage of our economy, which means wages will be lower. There'll be less economic opportunity for kids and grandkids. Those are huge problems moving forward. And we're going to have to come to grips with it. There's going to have to be a come to Jesus conversation at some point around that. But we would be so much better off if we had been smart up until this point and better positioned to respond. It's not that the response has been wholly inappropriate. It's that what we were doing before now was inappropriate and put us in a weaker place. So with that understanding, there are some good things happening in the world of public policy. We see remote learning opportunities, and people are getting an opportunity to figure out how to learn anywhere and everywhere. We see business practices that are dramatically moving the ball forward with remote opportunities, right? There are governors who are taking upon themselves to allow medical professionals from other states to come in and treat patients. That should always have been the case, but they've recognized the importance of mobility in dealing with this kind of crisis. There's been a massive expansion of the way that we think about telemedicine and telehealth, and hopefully we'll take the govern off of that Ferrari and let it run full speed moving forward. There are all sorts of changes that are being made in the labor market with occupational licensing reforms, lots of regulations that are being peeled back, changing the way that we're thinking about the CDC and the FDA and approval processes. And all of that could end up being super helpful when we think about the way that regulations and government actions currently affect our economy and the opportunity in our economy. There's actually a chance to do some really positive things, and states are already showing signs of it. The question is, do we make those things permanent or not? Do we address things like restrictions on the supply of healthcare with certificate of need restrictions that prevent hospitals and medical providers from doing the kind of business and offering the kind of services they want to offer, where qualified people want to help save lives and are prevented from doing that, or nurse practitioners who are wholly qualified to offer services to patients and are being prevented from doing that, prevented from practicing up to the full scope of their training and qualifications. So there are a ton of good opportunities in the public policy space coming out of this. There's also a ton of threat. And here's the biggest threat. It's not just the debt. It's not just what's already happened to the economy. It's the idea that government will not contract after this crisis. And there's historical precedent for this, right? 2008, 2010, we see that spread of the financial crisis. Government grows dramatically to deal with it. It never contracted back to normal levels. Never contracted truly back to normal levels. If you look at something on a state level, like Hurricane Katrina, we talked about earlier, I've looked at those numbers before in the state of Louisiana as an example. Their disaster spending went through the roof, and they never went back after the disaster was over and the recovery was over. So there's a real risk that the size and scope and intrusiveness of government stays at a high level, a level that ultimately really hurts the opportunity available to people in this country. And so we've got to be vigilant and guarding against that. And it's not just dollars and cents. It's also civil liberties. It's the ability to say what you want. It's the ability to assemble where you want. And look, I'm not suggesting that the guidelines have been bad guidelines. I think people needed to socially distance, particularly where we didn't have good information about how quickly this spread and how deadly it was going to be. And that body of information continues to develop. So I understand the precautions that have been taken, but we need to be very, very cautious and concerned about the potential that some of those restrictions could become permanent restrictions, could become a new normal that changes what makes our country so exceptional in the first place. Look, I've talked for an hour and a half. It's a long time. I hadn't intended to talk that long. I hope that you found it informative. If you stuck with me that long, this podcast is going to get super deep in the weeds in talking about public policy and ideas and cultural trends that have real impact on you and your family. If you find it informative, if you find it interesting, I hope that you will share it with other people. I hope that you will listen in the future. Submit feedback. Give ideas on things you'd like for us to talk about. Because we want to make sure that people are informed in a way that ultimately allows them to influence their circle of influence, influence policymakers, and advance good ideas that help all people reach their potential. Thanks for listening today, and I hope you'll tune in for future installments.